input you'd like to give us. Next slide, please, Tanya. Excellent, that's worked. So, and on that note, here are a couple of questions I wanted to ask you just to kick us off. Would you mind using your react buttons to give me a thumbs up if you've heard of OYES Sussex before? So that's 3. That's not bad. Or 4. So the majority of people in the room, that's good. That's good to know. And the second question is, how many of you have referred into the service? So about half of you. Oh, more than half of you. Oh, so it seems like people have heard of us and have referred into us. So that's good. Is it Eamon? Did you have a question? You've got your hand up. No? Okay.
No, I was just agreeing and saying that I've referred someone.
That you've referred. Oh, brilliant. Thank you. Thank you. Well, that's good. That is really good to know that you have heard of us and that you have made referrals to us. So hopefully what we'll be telling you today will still be of use for you and will give you a bit more information on what we offer. Could we move to the next slide, please, Tanya? Yeah, so this is the running order of today and what we'll cover. So first of all, I'll give you a brief overview of what it is that we do at OYES Sussex, and then I'll pass you over to the expert in the room, who's Tanya, who will give us a good deep dive into smoking cessation, what smoking harms are, and the benefits of supporting people to quit smoking, and in some detail the support that we offer in our smoking cessation service, and then we'll also have a look at some of the outcomes that we've had this year so far, and we'll then provide you information on how you can refer in, how you can book training with us as well, and some key contacts there that might be useful. And finally, we'll end with a question and answer session. So as I said, please do feel free to use the chat facility throughout the presentation. If a question comes up, if you want to pop it in the chat, and we'll make sure we revisit that at the end. So if we don't get to it in the middle of the presentation, we'll make sure we revisit it at the end and answer any questions you've got. And you'll also have an opportunity at that point to unmute as well and ask us any questions in person if that feels better. Okay, next slide, please. So what is it that we do at OYES Sussex? So in a nutshell, we support people to make small changes that can lead to quite a big impact on their health and well-being. So we provide a free holistic healthy lifestyle service. We are funded by Public Health and commissioned by East Sussex County Council. So we're not funded by the NHS, we are slightly different. And really, the aim of our service is to reduce the prevalence of lifestyle risk factors in the county that lead to people having poor health. So we want to reduce the morbidity and the mortality associated with these lifestyle risk factors. And ultimately, really have a healthier, happier population, happier community, and where people have less reliance on the health services and social care services. So that's the aim. You'll see the menu on the right-hand side of the screen there. So these are the things that we help people with. And obviously the big topic today is helping people to be smoke-free. But we also help people eat well, move more, drink less, and lose weight. So those are our sort of pillars, if you like, of the service. We have over 70 clinics across East Sussex. We cover the whole of East Sussex apart from Brighton and Hove. They've got their own healthy lifestyle service. We also have a camper van called Colin, who we take out and about, use as a mobile clinic space. I love driving Colin, apart from to country roads. That's slightly scary, but generally I like driving Colin. And we get out to the more rural areas and also the areas of higher need. So it enables us to have more of a presence there. And people love us to bring them along to their events as well, because it's a nice visual thing there. So yeah, next slide, please, Tanya. So I'll just tell you a little bit more about each of our services. So when somebody contacts us or is referred into us, the first thing that we offer is an initial health assessment. And that is to identify what it is that they'd like to achieve, any issues they may have, and that enables us then to triage them down to the right service for them. So if they're triaged into our healthy lifestyle coaching service, they'll receive 12 weeks of one-to-one support with a health coach to help them achieve their identified goals. So it's all very client-led, and it's around the pathways of move more, eat well, and drink less. So it generally tends to be around those subjects. If people want one-to-one coaching specifically around adult weight management, and they want it on that one-to-one basis, this can also be provided in that setting. So the other thing we offer in regards to adult weight management is small group support. And the advantage of this is people then have a peer group as well to support them, which a lot of people find helpful. So people attend these sessions. Again, it's 12 weeks. They are weighed, and so we can monitor their progress. We do also monitor sort of their well-being scores and things like that. So it's not just about the scales. And it's not a faddy diet. What it is we teach people about sustainable lifestyle changes that can help them achieve a healthy weight. So a whole range of issues are covered. It could be emotional eating, it could be the role of sleep or the role of movement on adult weight management. It could be supermarket tours and how to avoid market employees to get you to buy naughty things and more than you need. So it's a whole range of things, and it's really quite successful. Some of the sessions are based in gyms and leisure centres, and where they are, we've worked with partners there to offer people free gym and swim passes, which are quite popular and obviously help people get into that healthy habits with regards to movement and physical activity. We also have an online platform called Glogy Digital. So if people prefer to be more self-led, and people prefer to access support at different times of the day and night, then they can do that via the online platform. That does also include a weekly call with a coach if they'd like. And the final branch of our adult weight management offer, aimed specifically at men, is called Man v Fat. And an insulting name, but it's very popular, and it's effectively six-a-side football, but the matches are decided on weight loss as well as goals. And it sort of taps into that real competitive nature that men sometimes have, and women sometimes, and it's quite successful. People achieve their goals. Was there a hand up just then? Was it Sophie? Did
yes,
you?
hello. I was just literally typing. I didn't want to interrupt you. I was just wondering, like the adult weight management, has it got to hit a certain BMI or a certain weight for someone to qualify for that sort of group work?
Yeah, I believe it's BMI of 27 and over.
Okay.
To access that, and it's tier 2, what's known as tier 2. So yeah, what we don't offer is medication, which I know is a hot topic at the moment, isn't it, everywhere? But yeah, so we don't offer that, but we offer the lifestyle intervention. And I think our parent company, Thrive Tribe, are also looking at how we can support the NHS lifestyle support for obesity programs. But at the moment, where we are, it's just the lifestyle 12-week intervention that we offer. Has that answered the question? Yeah, brilliant. Thank you. Another service. Oh, Linda, did you have a question?
Yeah, sorry, I was just unmuting my mic. With the weight management, is that also for people that are underweight too?
It can be, yeah, but they're more likely to be seen as part of the healthy lifestyle coaching, the one-on-one for that, because the group work does focus on people really aiming to lose weight.
Okay.
But anybody who had a significant problem with that, so if they're any concern about eating disorders or anything like that, then they'd be referred to a specialist service, signposted to a specialist service. Yeah.
Lovely, thank you.
Ask as well, do you have to be over 18?
Yes, they do have to be over 18 for the adult weight management. Yeah. Although there's different ages for our smoking service, which I'm sure Tanya will cover. But yeah, for the adult weight management and the healthy lifestyle coaching, it is. And again, the next service I'm going to tell you about is our health checks, our NHS health checks. And again, they are over 18 as well. And what they are is really an MOT for your heart. So they take about 30 minutes and they cover lots of lifestyle questions, height, weight, your blood pressure, your heart rate, a little pinprick test, which enables us to test cholesterol, and also if some risk factors are coming up high for diabetes as well. And then at the end of the session, people get given their personalised healthy lifestyle advice, which also includes their heart age and their likelihood of having a cardiovascular incident over the next 5 to 10 years. And all this information is shared with the GPs. Actually, the NHS health check does have some eligibility criteria. So just to clarify the age range on that, it is 40 to 74. That's right. Yeah, so sorry, it's not available for all over 18. So you have to be in that age bracket, 40 to 74, and you have to have not already had a cardiovascular incident and not be on medication already for high blood pressure or problems like that, cholesterol. Yeah, but it's quite useful, and it's every 5 years people are allowed to access that. And as I said, that gets shared with the GP, that information. And the idea is that it's identifying problems people may have that they're not aware of. So we quite often get asked, why I'm 75, you know, am I not worth checking? I'm like, no, you absolutely are, but we are commissioned for that age bracket, and the idea being it's meant to perhaps detect problems that people aren't aware of. So that's that. Could I have the next slide, please, Tanya? We also offer free training to our health sector and community and voluntary sector partners. The training we offer is for health checks, for the Cobus machines, which are the machines used for the cholesterol testing, and also stop smoker advisor training. And these are available on request mainly. We do also offer Making Every Contact Count training, which is a public health initiative aimed at supporting people to have conversations around health and encourage positive behaviour change. But the idea is they tap into the millions of everyday conversations that we're all already having. It's not meant to create more work for you. It's just to help to make those conversations that may come up more effective, and then how to signpost people into good services. And that's one of our major training offers, is the MEC, we call it, Making Every Contact Count. And you can access our training. We've got a web page, oneyousussex.org.uk/training, and you can request training there. We also do some open sessions throughout the year that anybody can join as well, but we're happy to also arrange bespoke sessions for particular organisations who can come in and deliver those. So, and I'll share that contact information with you later on as well. One other thing that we've recently introduced this year is the Active Eastbourne and Lewis partnership. Hopefully you may have heard of Active Sussex and also Active Hastings and Active Rother, and there was a little bit of a gap there, and we've plugged that gap with the Eastbourne and Lewis areas. And the idea of that is that we're helping connect people and organisations and communities with ways that they can get more active with the providers of activity, to make activity and movement and leisure more accessible for people, with the ultimate aim of improving health and well-being. So that's the Active Eastbourne and Lewis, and we've got a website for that as well, which we'll share with you as well. So that's the whistle stop tour. Any questions at this point? No? Lovely. In which case I will pass you on to the main event. So it's over to you, Tanya. That's all right.
Thanks, Lisa. Hi, everybody. I'm Tanya Sutton. I'm the Stop Smoking Lead for OYES Sussex. Thanks so much for making time to come along today. I'm just going to tell you about our service and what a client should expect when coming into the service. So the aim of our service is to help the population of East Sussex quit smoking for good. And we provide personalised, evidence-based support to do that. So a couple of questions for you. How is smoking cessation relevant to you in your work and home life? If you want to share, you can. If not, just have a little ponder about that at home. And also, is there any specific information you'd like to find out today? No, that's fine. I'll carry on. But as Lisa said, if you want to, we've got a question from Sophie. Go ahead,
Yes,
Sophie.
I just, with the client group, I work predominantly with under 25 and just the huge issue of vaping. And I was wondering, do you kind of offer any support alongside? Obviously, is it just that they have to smoke and also vape, or is there anything solely for vaping? I wonder if you offer that.
That's a really good question. Up until recently, we weren't able to offer any vaping cessation support, but we are starting a pilot for that. And that's open to anybody who is just vaping, because we're very aware that we use an e-cigarettes as part of one of our quitting aids, and then a lot of people are left with vaping and they don't want to be. So we're just starting that off in the next few weeks. We've got a waiting list for that. Do you know what? You've just raised a good point, which is what all good pilots do when we first start. I don't know if we're actually doing just 18 and above, because our smoking cessation service for 12 years and above. But no one's actually clarified this is the vape cessation. So I'm going to get that clarified and I will let you know about that. I'll let everyone know because we've got all your email addresses. So thank you for that question. That's helped me out a lot, more than you know. Okay, thank you. If you've got any other questions going through, just put your hand up. So why do we help people stop smoking? It's because it's so devastating to people's lives, quality of life. It remains the single biggest modifiable health risk to individuals and to society. And we've still got an issue. I think the smoking rate in East Sussex is about 12 or 13% now, which is great, because since One East Sussex started, it was about 22. So we've really got it down, but we've got some way to go, which is why we continue helping people to stop smoking. And it's now seen as not a choice. It's not a lifestyle choice anymore, because once somebody is addicted, they quite often can't get out of it. They need help. So it's not a decision that they can make generally on their own. Oh, do you know what? I took that from somebody else's slide deck and I didn't know it was going to do that. So it's quite a flash. So the average loss of life expectancy is 20 years for people who smoke. And obviously the smoking related diseases will make, you know, the end of their life not so pleasant as well. So it's something we really must work on with partners as well, everybody referring into the service. So pathway to addiction. This is how addiction starts. So you've got number one, somebody smokes, delivers the nicotine to the brain. In 7 seconds, it gets through the blood-brain barrier. Number two, nicotine hits the receptors in the brain. Dopamine is released, and that is what causes the addiction. It's not nicotine in itself, it's the dopamine that nicotine causes the release of, and the brain loves it. It's a reward chemical. Then after about 2 hours, the dopamine's dropped, which leads to withdrawal symptoms. So a lot of people think that they are a stressful person and they need smoking to help with the stress, but it's not. It's the withdrawal symptoms from not having dopamine that causes the stress and causes the cravings for smoking. Then another cigarette. You need that. The smoker will need another cigarette to feel normal again. So a few truths and myths about cigarettes. So just again, think about these yourselves. I won't ask you to answer these, but cigarettes cause diabetes. Is anyone aware? It actually does. The risk for developing diabetes is 30 to 40% higher for people who smoke. And this list, not a lot of people know all of this. Alcohol increases the harmful effects of cigarettes. Yes, got someone nodding that it's correct. Those who smoke or used to smoke and drink alcohol are 3 times more likely to develop cancer, because alcohol can increase the harmful effect of the chemicals in tobacco and get inside the cells, especially in the lining of the mouth, throat, and esophagus. And it can limit how the cells repair the DNA damage caused by tobacco smoke. Low tar cigarettes are healthier than them. Oh no, sorry. If I cut down, I'll be healthier. Not really, because there's something called compensatory smoking. So the brain needs a certain amount of nicotine to give it a certain amount of dopamine that it's used to. So if somebody cuts down, the brain is still going to be going into kind of withdrawal symptoms. So without realizing, the smoker will drag harder on the cigarettes and use more of the cigarette to get that same level. So cutting down, you really still get the same amount of harm from the cigarettes. Low tar cigarettes are healthier than full tar ones. You'd expect this to be right, but it's actually not. They're not healthier. So there's changed the inhalation pattern to get more out of the cigarette, similar to compensatory smoking. And also the cigarette companies drilled holes in the filter so that they say that the tar comes out of there, but it's strategically placed where you put your fingers and hold a cigarette, so it blocks them off. So you're not getting any benefit from that. Cigarettes are the main cause of house fire death. That's correct. Even so much so that the fire service give out lap blankets now, especially to the elderly that smoke, in case they've dropped a cigarette or fall asleep whilst they're smoking. Are roll-ups less harmful? No, a lot of our smokers think they are, but they're not. And reports say that rolling tobacco is more addictive because it contains more additives. And some people don't use filters, so they're getting a lot more harm there as well. So benefit anyone from primary care here, you'll be really interested in this. The benefits for primary care of smoking cessation are huge. So you've got on average about 20 more appointments available per week because of the reduction of appointments taken up from smoking related diseases. This is if smoking cessation, so I should have explained this, if a smoking cessation service is in the practice, and this is the benefits you would get. So huge saving on halving unplanned hospital admissions, a drop in GP appointments overall, and a reduction in home visits. Now, this was taken from, I don't know if you've heard of the Sonia Simpkins study. It was a nurse in the Midlands who decided to do this study. She was working in a practice, and she got smoking cessation advisor there, and also the whole practice bought into this. So they were all trained in what the smoking cessation advisor would offer, a bit much like you guys here. And they had every single member of staff talking about smoking cessation to smokers, because there's evidence to show that if any healthcare professional doesn't speak about smoking to the smoker, then the smoker justifies it can't be that bad because my doctor, the nurse, whoever it might be, didn't ask me about it. So these would be the savings of having a smoking cessation advisor in the practice, and everybody feeding into that smoking cessation service. So, question for you guys. What percentage of people would you guess want to give up smoking? How many would say, and if you want to pop this in the chat to guess, percentage of smokers, how many would say they want to quit? You'll have to man this for me, Lisa, because I can't see the chat at the moment.
Lena's said 80%.
Okay.
Linda's guessed 40%.
Okay.
Eamon said 60. Sophie 65.
Okay. Well, the higher end is the correct end. So the population of East Sussex, thanks Lisa, is about 575,000 people. 12%, nearly 13 are smokers, which is about 73,000. And it's 75% who say they want to quit. So that's about 55,000 people in East Sussex say they want to quit. And only about 25% attempt to quit. And only 3 to 5% succeed each year. So, and the reasons why people might think that they, you know, they're worried about attempting to quit are things like they've used the nicotine replacement therapy, but only a single item. I'll come on more to this in further down the line, but they've lost faith in the stop smoking medication. They've tried it before and it's not working. They've gone cold turkey, that doesn't work. So, you know, and also some people haven't heard of the stop smoking service. So those all feed into the fact that not all smokers that want to stop try each year. And 3 to 5% might not sound very much, but it's about 1,200 people quitting each year. So it is chipping away at the smoking population. So impact of COPD of quitting. Hopefully you can see that slide better than I can because it's smaller on my screen. So I'll try and explain it. So the bottom line is the age in years of death. So the first solid line is somebody that smoked for their whole life. Then you've got the dotted lines. Somebody stopped smoking at 45 years old, somebody that stopped smoking at 65 years old. You can see that the longevity is increased just by stopping smoking. Of COPD, quitting is the only intervention to change the course of COPD. It's more, it carries more weight than the COPD medications. So it's really crucial if you are speaking to anyone with COPD, they need to stop smoking. It's the number one thing they can do. So why stop smoking is difficult. I'll let you read this list because, you know, if I'm reading it at a different rate to you, it gets really annoying. So read this list and it sort of highlights why, another reason why people find, you know, they can't quit, because there are some things on here that they would perceive as beneficial. So I'll just let you have a look at that. And the habit is actually the hardest thing to overcome, we find, with our clients, because we've got pharmacological interventions that we can use, which cope with the withdrawal symptoms and the cravings. But it's the habit, especially with people using roll-ups. It's they like the ritual of doing it. So they find it really, really hard. And it's the hand-to-mouth action. And the sense of who I am. Some of our smokers have been smoking all of their adult lives. Well, most of them have. They start early teenage years. And by the time they're quitting, they don't know themselves as a non-smoker. So it's challenging the sense of who they are as well. So it's a massive thing for people to quit smoking. So they need our help. So it's as I've said, it's no longer seen as a lifestyle choice. Cold turkey doesn't really work. Studies show that 97% of unaided quit attempts are unsuccessful. Accessing a stop smoking service increases the success of quitting by 3 times, because not only have you got the medication, you've got the behavior change as well. It's the longevity of smoking, not the dose, that causes the damage. So if you have somebody smoking 5 cigarettes for 20 years, that's more harmful to them than smoking 20 cigarettes for 5 years. So it's the longevity of smoking that causes the DNA damage. As I've said, quitting halts the progression of COPD, and all healthcare professionals should be asking. And we have some people that, so I've asked this patient or this client or this service user already, motivation pivots, it goes up and down. So if you're having the conversation and you get the client at the right time, they will be ready to go on and attempt to quit. But that's where we come in. Eligibility, we can support anybody over the age of 12 living in East Sussex. And our delivery model, we've got face-to-face clinics. As Lisa said, we've got 70 running all over the county every week. We've also got a telephone service that anyone that can't access face-to-face for whatever reason, it might be that they're housebound or have anxiety or a carer, we can put them onto the telephone service. And we offer free nicotine replacement therapy. In our face-to-face clinics, the advisors carry nicotine replacement therapy so they can hand it to the client on the day. If it's the telephone service, then we have it posted out to the client, so it may take a few days to get that. You might have heard of varenicline, or what used to be called Champix. We get a lot of questions about that. At the moment, Public Health are working out the best way to provide that. We think it's no longer through the GPs, so we are running a pilot at the moment to use a third-party GP federation to write the prescriptions for us. So that's in full swing at the moment. If you have any clients that you come into direct contact with that you feel would be really eligible for varenicline, then please contact me and I can put them on our pilot. So the results of that, we don't know yet if it's going to continue with this pathway, but as soon as we know, we can let all our partners know. These are where the clinics are situated, clustering in areas of deprivation, and a lot of these clinics in these areas run multiple times a week as well. So what we offer, the course runs for 12 weeks. We like to see clients every week for 6 weeks, and then it goes down to every other week for the following 6. And we ask them to set a quit date within 2 weeks. We get, a lot of our clients who are hardened smokers, who've been smoking for, 40, 50 years. How can you expect me to quit that quickly? I've been smoking for this long. But everything we ask of our clients is evidence-based. We know that setting a quit date within 2 weeks and quitting abruptly is more successful than a cut down to quit. Because what we find is that if somebody doesn't quit that quickly, there's generally a pattern, and they will keep the first cigarette in the morning and the one after dinner become so important to them. They can get rid of all the other cigarettes, but those two become so important, then it's a real slog for them then to quit those 2 cigarettes. That's why we say an abrupt quit, cut off, have a quit date, and say goodbye to cigarettes. As I've said, free medication, which I'll show you in a minute which medication we can offer, and intense behaviour change over the course of the 12 weeks, which is 9 appointments. So our first appointment is an hour, and we're really grateful for having this time because it enables us to build up a rapport with the client, which is crucial in the outcome of the client's quit. We go through a holistic health assessment, which includes emotional well-being, etc., and a PAM scoring, which is patient activation model. This shows us how responsible a client feels for their own health, which helps us tailor-make the support that we give to them. We go through height, weight, BMI, blood pressure, and the results of all of this enable us to onward refer, if the client wants to other parts of our service or other partners that will be beneficial for that client to access. We go through triggers, previous quit attempts. We do all of this so that we can take anything that was positive from the client's previous attempt and use it in this attempt, and avoid the pitfalls as well that they might have found in previous attempts. Any patterns to smoking, which they might not have thought about before. And then we conduct CO monitoring, carbon monoxide, which is given off by any combustible material. So there's a high dose given to the smoker from the cigarette. And that's motivational because no matter what level they are, as soon as they stop smoking, carbon monoxide comes out of the body within 48 hours. So by their next appointment, if they've stuck to their quit, they will have a non-smoker reading. So it's really motivational. That's something tangible that they can see. So the stop smoking medication, nicotine replacement therapy, we can offer from our service patches, gum, or lozenges in various strengths. So we step down the strength when the client is ready. And it's really important for smokers who are using nicotine replacement therapy to use combination therapy. This means patches plus another product. So, and it's really important. Our mantra is on the hour, every hour, they need to be taking their oral product, which is a lozenge or gum, because it keeps the nicotine levels up similarly to where they were smoking. So a lot of clients, we have a struggle to get them to take this on the hour, every hour, because quite rightly, you know, unless they know rationale behind it, they think, why are you giving me nicotine? That's what I'm addicted to. I'm trying to get off that. But the nicotine replacement therapy is such a slow release that it doesn't spark the nicotine receptors in the brain. So it takes care of the withdrawal symptoms whilst leaving the nicotine receptors alone. So, and after 2 weeks, nicotine receptors start dying out and becoming dormant after just 2 weeks. We also offer e-cigarettes. So we give a pack. So it's the device, a low amp charger, spare coils and liquids for 12 weeks. And we can offer 5 flavors in 4 strengths. So again, our aim is to use it as a quitting aid. So we swap somebody over to an e-cigarette. They will have patches as well, because you can't get as much nicotine from an e-cigarette as you did as the smoker would have got from smoking. So we offer that as a kit, patches plus an e-cigarette. We aim to reduce the dose down, nicotine content down throughout the course. It's not always possible. And as I've said at the beginning, some people might end up at the end of the course still vaping, and that's fine because it's so much safer than smoking. But if somebody then wants to quit vaping, we can put them through a 12-week course again to do vaping cessation, which works very much like the smoking cessation. We will offer them nicotine replacement to replace the nicotine in the vape, and step that down so that at the end of that 12-week course, they will no longer be addicted to nicotine and be no longer vaping. So a few vaping questions, frequently asked questions that come up that might be interesting to you guys. Can I use vapes with NRT? Yes, we've covered that. So that the smoker will get sufficient nicotine so that they aren't vulnerable to relapse. Is switching vape to vaping just swapping addiction? A lot of people have this question, but it's a nicotine delivery. So you're not swapping the addiction, you're changing the delivery of nicotine to a safer option. Why is vaping safer? There's no burning, so there's no carbon monoxide, and there's no tar. And it's the tar that causes, is the carcinogenic component mainly of cigarettes. So you're taking out those really, really harmful substances that are in tobacco smoke. And vapes aren't completely harm-free, but they are vastly safer than smoking because you haven't got those components. There's about 12 ingredients in vape e-liquid compared with 400 to 500 in a cigarette. When you light a cigarette, those 400 to 500 chemicals combine to make 4,000 different chemicals, 60 of which are carcinogenic. So you can clearly see the difference, that vaping is safer. News reports about cases of death and lung disease, mainly in the US. We haven't had any deaths from vaping in this country. And in the US, it was because there's a lot of people making their own liquids and putting cannabis and vitamin E acetate in the liquid, which causes, you might have heard of Avali, I don't know if you have, it's e-cigarette and vape associated lung injury. And also popcorn lung, you probably heard of popcorn lung. So that was due to a flavoring called diacetyl that was used in high quantities in popcorn factories in the States. And they found that there was a link with diacetyl, but these workers were exposed to very, very high volumes of diacetyl. And some of our e-cigarette liquids did contain diacetyl in very small amounts. And it's interesting that cigarettes can contain it as well. But due to the negativity around it, the MHRA no longer pass any e-liquid that has diacetyl in it. And all the e-liquids that we use have been MHRA approved. Are vapes just for quitting smoking? No, they're a good quit aid, but if somebody can't quit smoking, then using vapes is a lot safer. I mean, at one of the conferences for Public Health England, they said that anybody smoking is a public health emergency. So if everybody changed to vaping, it would be a good thing. Vaping makes me cough. A lot of people try vaping and then discontinue because they're coughing too much. This is due to either an incorrect inhalation method, because some e-cigarettes you have to draw the vapor in for 4 seconds, hold it in the mouth and then breathe that down. Other e-cigarettes you can breathe down like cigarettes, but also if they're using nic salts as well. There's 2 different types of e-liquid, one with and one without nic salts. The nic salts make it smoother on the throat, so then not so much coughing. Health benefits of quitting smoking. I don't know if anyone's seen this, but the health benefits start as soon as 20 minutes. The blood pressure and pulse return to normal, circulation improves. Then the next big milestone is 8 hours. The blood oxygen levels return to normal. And after 8 hours, the chance of a heart attack falls as well. 24 hours, carbon monoxide leaves the body. 48 hours, nicotine is gone as well. After 72 hours, breathing is easier and energy levels increase. Then 2 to 12 weeks, circulation is improved. 3 to 9 months, lung efficiency is improved. 5-year mark, the risk of a heart attack is now half that of a smoker. And at 10 years, the risk of lung cancer is half that of a smoker. And the risk of heart attack is the same as a non-smoker. So this is a really good, what we do in our service is we focus on the benefits. I think historically smokers were told, these are the bad things that are going to happen to you, and it kind of put them off. But if you highlight the good thing, evidence shows that they're more likely to feed into that and sort of buy into that and use that as the motivation to quit as well. So performance outcomes for One UE Sussex. We're very proud of this. We've helped 18,000 people quit since the beginning of One UE Sussex, which started in 2017. Last year, 2,944 people set a quit date, and we have an 11% loss to follow-up. So this is somebody that engages with the service and then we can no longer contact them. So 11% is very low. That we're really pleased with that. Also, we're really proud of our quit rate. The national guidelines for stop smoking services say that every stop smoking service needs to achieve 50% quit, but we're at 62%, which is really good. And also, historically, men wouldn't access services like ours, but we have kind of an even split between male and female service users, which is good. And just out of interest, 37% of people setting a quit date in 2024 used NRT, and 63 people opted to use an e-cigarette. So the challenges and opportunities for our service. So the barriers to clients are not being aware of the service. That's where you guys come in. So please help to spread the word and referring to us. They're worried they will be judged. So I think historically, stop smoking services, as I said, will be a bit negative. You know, if you smoke this week, you're not coming back next week. But it's totally different now. We don't judge anyone. We keep the service open. We say to them, you know, if you relapse, do not worry. The door's always open. Please come back and try, because we know that each relapse feeds in to the quit journey, and it's no longer a quit attempt and then you fail or you succeed. It's all part of the quit journey, and that's how we explain it to our clients, so they are happy to come back and they don't feel embarrassed. Concerned quitting will be more difficult than it actually is. I've sort of touched on this because people might have tried cold turkey before. They might have tried just patches or just a mouth spray or just gum. It's not enough. they're more likely not to succeed because they will go into withdrawal symptoms. So a lot of people are quite pleasantly surprised to quit when they haven't done it before, managed to do it before. Barriers to the service, reaching smokers. So we have an engagement team of 5 people, Lisa's team, who work tirelessly to try and get the message out there and try and get an awareness, but still there are some people that we don't reach. So sharing that with people, service users that you have would be great. Obtaining clinic rooms. We work best out of GP surgeries because we can work with the surgery and with their smoking patient list. But obtaining clinic rooms remains difficult for us. We just need a private space anywhere that we can see clients. So if you know of anyone or you have any space that you can offer to us, that would be fantastic. And of course, funding pressures, which everybody has. So that's always a barrier to the service as well. But we work around it. We're good at that. Working together. So please refer into the service. Please collaborate on outreach. If you're doing any outreach, get in touch with Lisa, because her team are very happy to collaborate with other organisations with outreach, and we can bring our camper van Colin along as well. Please do display our promotional material to spread the word as well, if you're in a position to do that, and offer clinic space. So that is it from me. Thank you so much for listening. If you've got any questions after the webinar that you think of, please do get in touch. But I'm going to hand you back to Lisa now, just to show you how to refer into the service.
Thank you, Tanya. So it's really, really easy to refer into our service. So we've got the website, you can see the address on the screen there. It's just OYESsussex.org.uk. And in the top right-hand corner, there's the Get Started button, and that's on every page on the website. And you just click on that. It's a 2-minute form to fill in, goes to our support team, who then aim to get back to you within 5 working days. You can also phone us on the number there, 01323 404 600, or you can email us hello@oneUEsussex.org.uk. Health professionals as well can also refer directly from their systems. So if you just type in stop smoking support or healthy lifestyle support, you should get our referral form pop up, and then it gets sent to our NHS email, so we can pick referrals up that way as well. So really easy and straightforward to refer in. Next slide, please, Tanya. If you're interested in booking a training session with us, there is a dedicated training page on our website. So it is just www.oneUEsussex.org.uk/training. And what you'll find on there is a list of the sessions that we've already got scheduled that are open sessions that people can join, which may well be online or in person. But there's also, you see on the screen there, you've got contact us at the bottom of the training page. You can click on that, and that will go to our training lead, Charlotte Stevens, who will get back to you. And we are very happy to arrange bespoke training sessions for people, for organisations, and we're happy to book a room at our office at Faraday House in Eastbourne for you to come in, or we're happy to come to you. We do generally ask there's a minimum of between 8 and 10 people to run courses, just to make it worthwhile and a good use of resources. But like I said, we do also do the occasional open session as well, which anybody can join. So if you did just have 1 or 2 people interested. The health check training, the stop smoking advisor training is on request. But the making every contact count training is what we offer more in terms of open sessions that you can join. And again, we can bespoke that for your organisation. I think there was a question relating to, let me go back up. Yeah, Polina, you said earlier in the chat, very important with asthma and COPD reviews, would be nice to get some useful tips on how to encourage people to stop smoking. And I think that question is quite relevant to our making every contact count training offer, because that really goes into a bit of detail around sort of behaviour change theory and how you can have those conversations with people. And it uses something called the COM-B model, where you're looking at people's capability, their opportunity and their motivation. And so the MEC training, the Making Every Contact Count training, looks at this in some detail and really helps equip people to have those conversations with people that help direct them to sort of positive behaviour change, and hopefully signpost into our service for the more intensive 12-week support for Stop Smoking or one of our other services. So Helena, I'd suggest you might be interested in the MEC for that. I don't know if that's helpful. I hope it is. What I'll do is I'll pop in the chat as well the link to that page. Excuse my slow typing. There you go. So that's shared with you. We'll also be sharing all these slides as well with you, so you'll have all the details. Would you like to go on to the next slide now, please, Tanya? Yeah, so question and answer. Does anybody have any other questions? I can't see any of us in the chat. Feel free to unmute, as we're quite a small group, aren't we, today? So if you have got questions, feel free to unmute and ask away.
Can I just ask, someone is smoking and they also smoke cannabis as well. Do you do work for that alongside that within the smoke cessation?
We don't offer sort of a cannabis reduction, but all our advisors are trained in helping people that do use cannabis, and they can suggest alternative ways to use the cannabis that isn't using it with tobacco as well.
Can I just ask one more question? Sorry.
Of course you can, yeah.
Because in my role, it does sadden me to see so many young kids vaping, and I mean, from 8 years old, some of my patients have vaped from. And obviously, I know you're doing that pilot. Is there anything that, I don't know, sort of maybe it's that Make Every Contact Count, maybe that would be beneficial, but it just feels it's something that I ask, something I talk about, how much nicotine is in it, how long have you been doing it? And I kind of think I do want to give a bit more than that, and obviously because there's not anything specific out there at the moment. Would you suggest anything, or any good sort of sites or anything to kind of do some further reading or support, anything like that?
There's a good website called the NCSCT. I can email you this information, and it's got a section on young people and vaping, which will be probably really helpful to you. But also I do think, yeah, MEC would be good because it teaches you how to open up the questioning and look for change talk as well. That's the big thing with MEC. You look for change talk, and you build on that and bring out somebody's motivation. So not only are you sort of encouraging them, you are bringing out their motivation to make a decision. It's all about intrinsic and extrinsic motivation as well. So MEC goes through that. So I think those two things might give you a lot more information to feel more confident in having the conversations.
Can I just add as well, I know East Sussex County Council have been working on a toolkit for mainly aimed at educators, secondary school level, around to help teachers and educators provide information to students, because obviously young people, it's one of the sort of target groups, isn't it? A lot of young people are vaping. So I think that's a work in progress though, but at some point, I mean, Tanya mentioned before, we're doing a pilot on helping people to quit vaping. So at some point, I imagine my team, the engagement team, will be hopefully in a position to come out and give advice on and information to people on vaping and how to access our service moving forward, if that is something that we're commissioned to do. Which is still a bit of a question mark about, isn't there, Tanya?
Yeah, there is, yeah, for now. But I'll email in our after course email. We'll put the vaping information in, the link to that for you.
Thank you.
Just can see some people typing. Ashley and Linda are both typing. We'll see what pops up. Oh yeah, have to go, 12 o'clock appointment. No problem at all, Ashley.
I just noticed.
Thanks very much. Thank you. Bye.
Thank you for joining us. I'm glad you all enjoyed it. So I guess our last questions for you was, do you feel you know what the service offers now? A thumbs up or a thumbs down? And do you feel you now know how you could refer into the service? Yeah, heart. Oh, I like the heart and the thumbs up. Brilliant. Brilliant. So any questions, do please feel to contact us after the session, as Tanya said, and we'll endeavour to answer any other questions that might occur to you.